It began not with a bang, but with an eerie, creeping silence. One day in early 2020, the familiar rhythms of our world simply began to fade. The morning rush hour traffic thinned until the highways were empty arteries. The boisterous sounds of children playing in schoolyards were replaced by a profound quiet. Airports became cavernous halls. Departure boards showed only cancellations. It was a moment suspended in time, a collective pause felt in every city, town, village across the globe. Suddenly, the world we knew stopped turning on its axis. We found ourselves standing still, looking around in disbelief. In the stillness, unease settled, and a new chapter began. The cause of this global standstill was an enemy we could not see, touch, or hear. It was a novel coronavirus, scientifically named SARS-CoV-2, causing the disease we came to know as COVID-19. A virus is a microscopic agent, far too small to see. Think of it as a tiny biological piece of code. It cannot replicate alone. It must invade living cells like a human being to make more copies of itself. It spreads mainly through respiratory droplets and tiny aerosols released when we cough, talk, or breathe. Nearby people can inhale them through the nose, mouth, or eyes. Particles can settle on surfaces, then transfer when we touch our faces. Hand washing, masking, and not touching the face became vital defenses. Inside us, the virus latches on, hijacks the cell, and triggers symptoms that range from mild to severe. In our interconnected world, a virus can travel as fast as we do. COVID-19 spread on the currents of human movement. It began in one city and did not stay long. It hitched rides on airplanes, trains, and ships, silently crossing continents. An infected person without symptoms could carry it thousands of miles, then pass it on in transit hubs and public places. The pattern repeated, a few cases, then rapid, exponential growth. Health systems struggled to keep up. Tracking chains became impossible as community spread took hold. Major hubs became epicenters, sending ripples into towns and rural areas. The virus ignored borders, ideologies, and status. Confronting it required cooperation, information sharing, and a recognition of our shared fate. We learned we are linked by more than trade and travel. What happens to one of us can reach all of us in weeks. Faced with rapid spread and the threat of overwhelmed hospitals, governments acted. They built walls of policy to limit contact, lockdowns. If people do not meet, the virus cannot move. Stay home except for essentials, food, medical care, critical work. The aim was to flatten the curve so hospitals were not overwhelmed at once. Slow the surge to save lives and buy time for science. Schools and universities moved online. Non-essential businesses shut their doors. Public gatherings stopped. Concerts, sports, celebrations. Masks and distancing added layers of protection. It was a painful trade-off. Health protection versus economic and social cost. Jobs were lost, finances strained, and isolation tested mental health. Restrictions slowed the virus and gave time to develop treatments and vaccines. The impact reached every corner of life. Healthcare systems strained as frontline workers carried impossible loads. Shortages put caregivers at risk. They became heroes and bore the heaviest burdens. Lockdowns brought loneliness and anxiety. Grief touched countless families. Work shifted home for many, blurring the line between living and earning. Others could not stay home, keeping society running at personal risk. The crisis exposed and deepened inequalities. It sparked urgent conversations about equity and justice. Yet we also saw resilience, creativity, and care for one another. Out of the great stillness, we asked what truly matters and how we might rebuild, wiser than before. What did COVID-19 change forever?